Hair transplant surgery time really depends on how many follicular unit grafts that we're placing in your head. For instance, if we're doing only 500, it may only take about 3 hours. But typically, our patients will have anywhere from 1,000 to 1,500 grafts placed at one time. And the entire process, from the moment you come into our office to the moment that you are ready to leave, it could take up to 6-7 hours. So there are two widely available hair transplant surgical techniques. The first is called a strip method, where we take a strip of hair from back of your head, and under a microscope we dissect each hair follicular units, and those units are placed into the areas that you need the hair. The second method, which is now becoming more popular and gaining more traction, is the automated follicular unit extraction system, where we use a small machine to extract each follicular unit from back of your head, and we transplant it into the area that you need the most. And this is really the more popular now, because it leaves no scar and less pain and quicker recovery. The third, which is coming onto the market, is called a robotic hair transplant system. And again, this is still in somewhat an infancy state, and I believe it's going to take a few years before it becomes widely available. Hair transplant surgery have several phases of recovery. After the procedure, about 7 days after, you may be able to shampoo your hair, including the area that's been transplanted. And really by third week, you could color, perm, and style your hair. And by fourth month, you see some growth. And this is an exciting time for a lot of our patients, because they could actually see the growth of the newly transplanted hair follicles. And by 8th or about 10th month, you should see a full effect of the transplanted hair. And that's the typical recovery phase of hair transplant surgery. With the advent of the automated follicular extraction system, we can now do a hair transplant on women, and this is very exciting. Women go through different phases of hair loss, not like men. And with automated system, we could extract this hair from back of your head and transplant it into the area that you're balding. For most women, it is the central region or top of your head that tends to thin, and this new technique really allows us to focus in that area and to make that area look thicker.